So, can you see my screen right now? No?
No, sir.
No, sir.
So I'll try to fix it. Is it better right now?
Yes, sir.
Yes, sir.
Okay, so I have already told you that today is continuum of tumors, and today we should discuss hemoblastosis and some other tumors which we can see in our clinical practice. So, first of all, we should start from the hemoblastosis. And hemoblastosis, it is a group of diseases which include leukemias and lymphomas. It is tumors of blood system and tumors of lymphatic system. So, leukemias, it is a systemic neoplastic disease of hemopoietic tissue, and lymphomas, it is a regional neoplastic disease of lymphatic tissue. So, please pay attention on the slide. We can see mistake. In lymphomas should be lymphatic tissue. Etiology of hemoblastosis may be different. It may be associated with radiation, it may be associated with chemical cancerogens, viruses, and genetical factors. For example, in case of X-ray radiation, we will see damage of DNA, and in result of it, we will see formation of leukosis. In case of chemical cancerogens, we also may see some leukosis. It's most typical for polycyclic amines and where alteration of our DNA. Viruses, some viruses, for example, like Epstein-Barr virus may lead to formation of Hodgkin's lymphoma. And genetic factors, most of all, it is associated with damage of 13th chromosome and chromosome number 22, where changes in their location, changes in their structure will lead to formation of leukosis, leukemias. So, leukemia, I have already told you a definition. It is a systemic tumor of hemopoietic tissue, and I hope you remember that hemopoietic tissue in our organism include a lot of different organs, but the most of them are bone marrow, lymph nodes, spleen. Sometimes we may see some hemopoietic tissue in the liver or in thymus gland and so on. Unlike other tumors, leukemia are initially systemic in nature. Tumor cells are very often detected in the peripheral blood. The clinical process is characterized by wave-like course with excavation and remissions, and this is deadly disease. Unfortunately, in any cases of leukemia, we will see that patient will die. But nowadays we can see a lot of different methods of treatment, and all of these methods are associated with transplantation of bone marrow because the tumor is localized in the bone marrow, and if patient has this disease and some tumoral cells in the bone marrow, it will in any case will lead to progressive of disease. So I hope you remember that bone marrow can contain a lot of different pre-cells, like cells pre-erythrocytes, pre-leukocytes, and pre-thrombocytes or pre-platelets. All of these cells could be the source for tumor growing. We will talk about it a bit later. But all leukemias characterized by occurrence of clone of tumoral cells in the bone marrow with their migration into the peripheral blood and other organs. So the localization of tumoral cells in our organs should be examined like metastatic process. So we may see some metastasis in liver, in kidney, in spleen, in lymph nodes, with development in internal organs of leukemic infiltrations. And I should repeat it the leukemic infiltration will be an example of metastatical process here. According to course of leukosis, new tumoral cells become more and more malignant, and their malignization associated with losing of their differentiation. So, for example, in normal cells, we may see erythrocytes or myelocytes or, for example, leukocytes. But in case of leukosis, we will see that leukocytes become to leukoblasts, and leukocytes will be less differentiate. So the losing of their differentiation will be associated with losing of their function. So it's so-called transition from monoclonal to polyclonal situation. So in the beginning of leukosis, we may see accumulation of only one clone of tumoral cell, but in the development of disease, we will see a lot of different sources for tumors. Infiltration of bone marrow by leukemic cells is accompanied by suppression of all other shoots of hematopoiesis. It's caused by anemia, hemorrhages, reduction of immunity, sepsis, formation of ulcers and defects, and the foci of necrosis in the internal organs. So overgrowing of one clone of cell in the bone marrow will lead to depress of all other cells in the bone marrow, and like a result of it, we will see depress of these functions. For example, depress of leukocytes will lead to depress of immunity system, and like a result of it, we will see development of a sepsis, and decrease of the platelets will lead to hemorrhages and some problems with thrombosis. There are a lot of different type of classification of leukemia according to the degree of maturity of hematopoietic tissue, cell, and nature of the clinical course. All leukemias divide into acute with undifferentiated cells, and undifferentiated cells mean that these cells should take the first three grades or first three classes of differentiation, and blast cells, which associate with the fourth and fifth grade or fifth class, proliferate in the bone marrow. So I hope you remember this scheme from the histological department, and they mean classes of the cells progressive. They mean like this scheme. I mean this scheme. So first of all, we may see progenitor cell in our bone marrow, and I have already told you that any type of progenitor cells will lead to formation of platelets, erythrocytes, and platelets, like here, excuse me, platelets, erythrocytes, basophils, eosinophils, neutrophils, and all other types of leukocytes. So, in case of acute leukosis, the cells will be the first three parts of the first three stages. They are localized here. So it may be progenital cells, it may be promyelokaryocytes, and all other blast, for example, cells. It may be myeloblast cell, lymphoblast, monoblast cells, and all other blast cells. So the cells of acute leukosis localized in this part of the scheme. I hope you can see my laser. And like a subtypes of acute leukosis, you may see undifferentiated type, when we may see only progenitor cells in the bone marrow and peripheral blood. It is one of the most malignant type of leukosis. we may see myeloblastic, lymphoblastic, and monoblastic form of leukosis. General characteristics of acute leukemia is characterized by leukemic failure. And leukemic failure, it is a mature and blast cells are found in the peripheral blood and transitive cells are absent. There are more than 20% of blast cells in the bone marrow. Medial leukemic infiltration as a blast cells in the internal organs. More often we can see acute leukosis in children. So the acute leukosis unfortunately more typical for children, and acute leukosis more malignant and way faster leads to death of a patient, unfortunately. The course is malignant with anemia, hemorrhagic syndrome, and infectious complications. We may see anemia cause we may see decrease of progenitor of erythrocytes. Hemorrhagic syndrome cause we may see decrease of progenitor of platelets, and infectional complications cause there are a lot of leukoblasts in the peripheral blood, but these cells are not differentiated, and that's why they couldn't do their function. The most frequent cause of death is hemorrhage in the brain, so the most important reason of death here will be associated with hemorrhages. On this slide we may see some infiltrates, leukemic infiltrates in the liver, and I should repeat it again, it is an example of metastatic process here. So I hope you can see this area of leukemia infiltration in the liver. It is the same area, but closer we may see a lot of different cells, and these cells are hyperchromic, and all of them has different form, different size. That's why we may think that these cells are abnormal, they are tumoral cells. Hemorrhagic in the brain, I have already told you that it is one of the most typical, most common reason of death. So we may see a lot of small hemorrhagic stroke here, and it is associated with problems with blood coagulation and problems with vessels. Not only in the brain the places of hemorrhage are localized, they also may be localized in the skin, like here, and we may see some petechial hemorrhagic point here in the skin. One more photo with the same manifestation, but some bit different localization. It is a backside of knee, and we may see hemorrhage dots here. Also, we may see some problems in the lungs and accumulation of lymphoid infiltrate there. In the gastrointestinal tract also we may see increasing of lymphatic nodes and hemorrhages here. One more manifestation, or it is intestine in leukemia, and we may see proliferation of lymphoid tissue here, which associated with metastatic process of leukemia in ferrous plaques in the intestine. It is again hemorrhagical complication in the internal organs. It is an endoscopic view of gastrointestinal tract, and we may see some points of hemorrhage here, a lot of them. And like one more complication in the brain, hemorrhage in brain, in the lobe, frontal lobe of the brain here, and in the this part of the brain also. Acute lymphoblastic leukosis, characterized by lymphoblast prevail in the bone marrow and peripheral blood. So, we may see lymphoblast in the peripheral blood. More often again in children, and we may see T lymphoblastic leukosis. And it's given in therapy, so we may sometimes we may try to help this patient, and where this patient has more good prognosis for life. Cytogenic forms of acute leukosis associated with indifferentiated leukosis, when we may see only progenitor cells in the peripheral blood, and we couldn't understand what is the nature of these cells and what their morphological type. Myeloblastic leukosis, and we have already discussed it, lymphoblastic leukosis, monoblastic leukosis, erythromelaloblastic leukosis, myelocaloblastic leukosis. I want you to pay attention for ending of these cells. So blastic, blastic, blastic. So it is will be very important if you be not a hematologist. Hematologist will make conclusion about peripheral blood, and he will write to you the form of the causes. And please pay attention to the ending. If you may see suffix blastic or ending blastic, it means that patient has acute leukosis. It doesn't matter what is the first part of it. So, and indifferentiated form of leukosis is also acute. It is necessary to remember it for your clinical practice. But if you will be a hematologist, you will differentiate all of these cells, but it is a really difficult specialization. Acute myeloblastic leukosis, characterized by presence of myeloblast in the peripheral blood and in the bone marrow. More often it happens in adults, and we really sometimes we may help this patient, but most often we couldn't. So mostly it will lead to death of the patient, and we couldn't change anything. Chronic leukemias. So we should see cytic form of a cells. So they will be like myelocyte, erythrocyte, or megakaryocytes, and all other types of chronic sites which may see on this scheme. It is really important to understand that chronic leukemia characterized by more differentiated cells, and that's why we have more likely prognosis, more favorable prognosis, because these cells are more differentiated. That's why we save some functional activities which we should have. That's why patient will have more long term of life. Leukemia includes the following variants. Leukemia with myelocytic origin, it is chronic myeloid leukemia, erythromeyeloid leukemia, erythemia or Buckey's disease, true polycytic anemia. Lymphocytic origin, chronic lymphocytic leukemia, skin lymphomatosis or disease of Cesare disease, paraproteinemic leukemia, and leukosis of monocytic origin, and chronic monocytic leukemia. General characteristics. Leukemic infiltration are more mature cells, longer benign course, but in terminal stage may be malignant course with blast creases. So in the ending of chronic leukemia, we may see some blast manifestation in the peripheral blood. And if you see the deep blast cells in the peripheral blood of a patient with chronic leukemia, it means that this patient will die soon. Cytogenic form. like myelocytic leukosis, lymphocytic leukosis, and monocytic leukosis. Chronic lymphocytic leukosis, frequently it appears in men at the age of 60 years old and older, so it is a leukemia for elderly patient. Leukemic cells are of B lymphocytic origin, and it characterized by leukemic variant, so the number of leukocytes more than 50,000. Local leukemic infiltration of bone marrow. Leukemic infiltration are located as foci outside of hepatic lobes. Patient life 3 or 7 years independently of treatment. So we really couldn't change something. The course of disease will depend only of situation in the bone marrow. Chronic myelocytic leukosis. It is tumoral cells appear by myelocytes. It is manifested itself in the middle age from 35 to 50 years old, maybe chromosomal pathology, may be associated with derangement of 22nd and 10th chromosome and Philadelphia chromosome, it is a 13th chromosome. Again, it has leukemic variant, diffuse leukemic infiltration in the liver, spleen, and lymphoid nodes, and bone marrow is pyoid. What does it mean? It means that in case of biopsy, the bone marrow will look like separative masses, like sap. It will have some green color, it will have fluid consistent, and it is associated with proliferation of myelocytes in the bone marrow. Depending on the number of leukocytes in the peripheral blood, leukemias are divided into leukemic leukemias, more than 25,000 leukocytes, subleukemic, between 15 to 25,000 leukocytes, aleukemic, where normal content and even blood cells in the blood may be absent, and leukopenic, when we will see reduced leukocyte count in the blood. So, a number of leukocytes in the peripheral blood are really important to clinical picture of the disease and for our understanding of the prognosis for this patient. Then more leukocytes could be found, the better prognosis, the worst prognosis is. But in case of leukopenic leukosis, we also will lose the patient soon. So some of the most benign is subleukemic and aleukemic forms of leukemias. Pathological anatomy of leukemia. In the bone marrow with leukemia, hyperplasia of tumor cell is detected and it's become juicy, yellow-green in color, resemble pus or sap. And the alveoli is called pyoid. This is especially true for chronic myeloid and acute myeloid leukemia. Due to the supplant of red blood spawned by leukemic cells, we may see anemia, and the disease will be leukoanemia, which is typical for all leukemias. Since leukemia is a tumor, metastasis in our organ is characterized of its cells. Where accumulation in organs is called leukemic infiltrates, and I have already told you about accumulation of leukemic infiltrates in the kidneys, spleen, liver, and so on and so on. Especially characterized by damage to the liver, spleen, the organs will be increased in size, and this is called hepatomegaly and splenomegaly. Organs with chronic leukemia, especially chronic myeloid, reach and large size, leukemic infiltrates, and the meninges, and the brain are very dangerous, which cause neuroleukemia. And also this type of leukemia will have some special complications which will be associated with damage of brain. Hemorrhagic syndrome is characteristic of leukemias. Hemorrhages in the skin, mucous membranes, and serous membranes, internal organs. There are hemorrhages due to the disemplantment of platelets in the bone marrow and in the increase in the vascular permeability due to leukemic infiltrates in their wall. For leukemias, due to the fact the leukocytes don't perform their function and decrease in immunity. And in the additional of infections are characteristics. Therefore, often there are ulcerative necrotic processes, often along the respiratory tract and digestive tract, necrotic angina, ulcerative necrotic gastritis, enteritis, and colitis also. Often the disease ends with the development of pneumonia and sepsis. Patients with leukemia usually die from the several hemorrhages, we have already told about it, bleeding, gastrointestinal bleeding, pneumonia, sepsis, anemia, and necrotization process in the gastrointestinal tract. Lymphoblastic leukemia is more common in children. Leukemic infiltrates in the substance of the brain and spinal cord are very characteristic. In the treatment gives good effect with long-term remission. Chronic lymphoid leukemia is more common in old age, occurs febrile, in the liver. Leukemic infiltration is focal by nature. The cells are localized only outside the lobes, along the Gleason capsule of the and portal tracts. Chronic myeloid leukemia is one of the most frequent leukemia, and its marker the detection of the Philadelphia chromosome. The disease proceeds in two stages: monoclonal benign and polyclonal malignant phases. Leukemic infiltrates in the liver are diffuse, capturing not only the portal plaques but also penetrating into the lobes. Paraproteinic leukemia. Besides paraproteinic leukosis can be distinguished by myeloma disease, macroglobulinemia of Waldenstrom, and some other. This group includes three diseases: myeloma or Risutsky primary macroglobulinemia and heavy chain disease or Franklin disease. A specific feature of the paraproteinic leukemia is the ability of the tumor to synthesize special proteins, paraproteins. In the case of paraproteinic leukemia, tumor cells differentiate according to plasma cells, retaining in the peripheral form and the particularity of the plasma cells to synthesize immunoglobulins. The most important among paraproteinic leukemias is myeloma, because you will see a lot of complications of this disease. For example, myeloma of kidney. Myeloma disease or Ristitsky disease, multiple myeloma, generalized plasmacytoma, it is the same diseases, mainly occurs in adults, describes the single observation in people younger than 30 years old. The disease and tumor cells received the name in the connection with the predominant localization of the process in the territory of the bone marrow, myelon. Myelon, it is a bone marrow territory in Latin language. There are several variants of myeloma depending on the nature of the spread of myeloma infiltrates in the bone marrow. on the variety of myeloma cells and the type paraproteinemic synthesized. By the nature of prevalence of the tumor, infiltrate in the bone marrow a diffuse, nodular, multinodular forms of myeloma are detected. According to the cellular composition, we may see plasmacytic, plasmablastic, and polymorphic and small cell myelomas. Tumor tissue grow mainly in the flat bones like skull, ribs, pelvis, sterna, and so on, and in the spine. Osteolysis, osteoporosis, axillary resorption occurs in the bones, which often leads to pathological bone fractures. And one of the most typical complications is a bone fracture, and with all other complications. The protein enters the bloodstream, and the hyperproteinemia, dysproteinemia, paraproteinemia occur in it. The protein is excreted in the urine, so paraproteinuria is very characteristic. The protein is absorbed by the canaliculi of the kidney, so the myeloma kidney, paraproteinemic nephrosis, amyloidosis, and pyelonephritis can occur in them, which often lead to uremia. Myeloma cells is malignancy of plasma cell or B lymphocyte belong to immunoglobulin G or A. Leukemic leukosis, it is a next characteristic of it. Leukemic cells are not present in blood. Myeloma cells are in the bone marrow, flat bones. It leads to osteoporosis and metastatic calcification. Anemia, leukopenia, and thrombocythemia are development. And like a complication of this process, we may see development of amyloidosis. It leads to chronic renal failure. So, and in the end of our class, we should discuss the lymphomas. We have already got the definition of lymphomas. It is a regional tumoral disease of lymphatic system, and classification of lymphoma is really easy. Lymphomas divide into groups: Hodgkin's and non-Hodgkin's lymphoma. And non-Hodgkin's lymphoma include T and B lymphocytic lymphomas. The main characteristics of lymphoma: tumor in lymphoid tissue, lymphadenopathy, and we may see fever in clinical features of this disease. Hodgkin disease. It is a chronic disease which is characterized by growth of tumoral tissue in the lymph nodes. More often we meet it in young men. There are two clinical forms, isolated and generalized. Cellular polymorphism is present. Secondary changes of tumoral tissue are present by foci of necrosis and sclerosis. So, cellular polymorphism of Hodgkin's lymphoma is associated with accumulation of giant cells of Sternberg-Reed-Berezovsky cells. We may see it on this slide here. Big and small cells of Hodgkin, cells popcorn, and some other lacunar cells, lymphocytes, histiocytes, plasmacytes, and some other cells. So we may see Hodgkin cells or cells of Reed-Berezovsky-Sternberg here. So they looks like a coal. One more photo of this pen. On this slide, we may see overgrowing of connective tissue in the lymph nodes, and of this overgrowing, will be associated with progressive of Hodgkin disease, and it manifestates sclerosis. And also we may see some changes of the spleen, and here we may see porphyry spleen. It is a special complication of Hodgkin disease. We may see some nodes in the liver or in the spleen, and the spleen becomes solid, and we may see big tuberculum inside of it. Morphological variants of Hodgkin lymphoma. With the prevalence of lymphoid tissue, few tumoral cells are met there. With the nodular sclerosis, necrosis and sclerosis are prevalent in the lymph node, mixed cell variant, and with suppression of lymphoid tissue, the tumoral cell prevail in lymph node. And the last type of tumor which we should discuss are teratomas. There are included tumors arising from the several types of tissue, more often detected in the childhood. Sometimes we may see it in adults, but it more often detected in ovary. There, in addition to epidermis, can be detected hair, fat, teeth, thyroid tissue, nervous tissue, and some other sites. For example, on this part of the slide we may see ovary, and inside of ovary we may see teeth and some hairs. So it is a teratoma. It is a tumor from embryonal tissue, which migrate in process of development of newborn and leads to formation of this organ in some abnormal places. One more example of teratoma here. So it is all theoretical part of the class. Thank you for your attention.